Hello, it's Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VETchat, the UK's #1 veterinary podcast. And very fortunate today, I've got, can I say, a fellow disruptor of the veterinary profession, Martin Whitehead, on the line today. Martin is a practitioner based down in Chipping, Norton. But I'm going to read, I don't always do this because I let usually other people read out their kind of history, if you like. But Martin's is so interesting, I'm going to just go ahead and read it. He's actually, I think it's fair to say, Martin, you took a circuitous route to the veterinary profession.
Yep, certainly did.
Did a psychology degree first, then did a PhD studying the sounds produced by the ears of various vertebrates from frogs to humans. Did basic and clinical research in tertiary care, medical school, ENT departments in the USA. Obviously, you got bored of looking after humans, so you decided to become a vet. Worked in rural mixed practice as well as exotic pet and zoo work for over 15 years. You're the clinical director now of Chipping Norton Veterinary Hospital and an advanced practitioner in small animal medicine. Interested in lots of different things, particularly exotic pet practice and zoo animals. But I think it's fair to say that we stirred up the water a little bit a few years ago when you came on and did a webinar with us about ectoparasiticide use, which I think was controversial at the time. People like the BVA have now been getting interested in it as well. Obviously, it was a vet-sustained webinar that we did. And we're seeing real changes there with the various companies bringing out risk assessments on when to use ectoparasiticides. But I think I'm going to, for full disclosure, Martin, before we start going down that particular avenue, I'm going to say mea culpa, because I am guilty as being the first person to set up a VIP plan in the UK back in 1999. I'm sorry, and the only thing I can do as a defense for myself is a much greater authority and a wiser man than me, Mike Willard, who's a professor of gastroenterology, now emeritus at Texas A&M. If you haven't listened to any of his webinars, Martin, or anybody listening, do go and search them out because the man is amazing. But one of the things he says quite frequently is, in a beautiful Texas drawl, everything I taught you 10 years ago was a lie. I just didn't realize. So maybe there's an excuse for some things we did. I was over in Texas at the AVMA conference, first time in Texas, in Austin, and his farm is not far away in Seguin. And unbeknown to me, he's retired, as Texas A&M, but he actually runs a sustainable sort of Pekin farm there, the Pekin nuts. And just looking at how he was trying to run the farm in a sustainable way was fascinating. So there you go. I've given my confession, Martin, to you. It was 25 years ago. So, and then also as a dermatologist, I've used a lot of ectoparasiticides in my time. But I think what we're hopefully going to talk about today is what's your vision of how do we use these drugs? Because they're useful drugs, obviously. If you've got a cat with flea allergy dermatitis, as a vet, we have a duty to make this animal better. So how do you square that circle? Where are you at in your thoughts now, 2 to 3 years after, if you like, you lit the match? What are your thoughts on where we're at and how we should be moving forward clinically, but also politically, with the firms, et cetera, et cetera?
Well, to my mind, there's obviously nothing wrong with sort of VIP plans in the sense of people paying for regular treatments with a direct debit or that sort of thing and getting a discount for it. The real very bad thing I see is this idea of having you've paid for your drugs year round, so you should be giving drugs year round for both preventing worms and preventing fleas. Yeah. That absolutely promotes irresponsible prescribing of really powerful pesticides. So that in one sentence is my message. We have to stop those routine year-round pet health plans.
And I think if we need to look anywhere, we only need to look at large animal and equine, who are working in a different way, aren't they? I remember when I was in large animal practice, and one of the things we used to say was, we can give advice on wormer, but if you go to the merchants and buy a wormer and use it at the wrong time, it's a waste of money, but also you can be creating resistance. And I think it was at our Veterinary Green discussion forum, Rob Lowe was talking about using lungworm larvae vaccines to reduce the use of anthelmintics, and how that's had a profound effect on dung beetle populations, which are massively important members of the ecosystem, which we, ignore at our peril.
Yeah, absolutely. So there's differences, obviously, between the large animal and the equine side and cats and dogs in various ways. The wormers, the big problem is resistance and some environmental effects. For cats and dogs, there is some resistance for sure. In America, in particular, with the heartworm, which obviously we don't have here. In some areas, there's a lot of macrocyclic lactose resistance to them. Hookworms, which are a much bigger problem there. Lots of multi-drug resistance in those. And there's even been reports of praziquantel resistance in Dipylidium tapeworms.
Yeah.
But really, a lot of the problem with the cats and dogs is more to do with the environmental impact, especially with the flea treatments. And it's probably not affecting so much dung beetles because the dogs and cats aren't out in the fields, but it's going down the drains and getting into rivers and will be affecting invertebrates that way for sure.
Again, it's interesting, Martin, as a dermatologist, I was there when fipronil came out, when imidacloprid came out. And going to the dermatology conferences, we knew that fipronil went into sebaceous glands and imidacloprid was much more water-soluble, fipronil was much more lipid-soluble. So actually, you had to work harder, because one of the things I would also do to lessen my use of antibiotics, which is obviously another discussion we could have, is I would shampoo my dogs regularly, to help with their skin problem. But at the same time, I needed something to protect them when I thought that they had a flea element to their problem. And I said at the time, we can't use imidacloprid because we know that as we wash a dog, the efficacy of imidacloprid plummets very quickly, whereas actually fipronil does stick around, and you can get away with washing a dog without getting all of the fipronil out, because of course it's stored partially in the sebaceous glands. But I never quite made that link in the way I had done with amitraz, that, well, where was it going? It was going down the drain, particularly imidacloprid, but I think now with the studies done, we can see that they both go there.
Yeah.
But I know with the work that you've done and also Rose Perkins has done, actually, we think that some of that also just comes from our own fingers, where we've applied the medication onto our cats and dogs, doesn't it?
Well, actually, we haven't looked at the amount that gets on fingers when it's being applied, and I'm sure there will be a lot there. What we looked at was people several days to a couple of weeks after the application, when they came to us to take part in the study, Rose got them to wash their hands and then measured either the fipronil or the imidacloprid in the water off their hands. So that was just coming off being around their dog, from stroking the dog and maybe touching furniture and blankets and things that the dog had been on. So I'm sure there will also be a lot from the application, but actually a lot of what's going down the drain, it's not coming straight off the dog, it's getting onto people, and then people are washing their hands and it's going down the drain. But obviously it's going down the drain when the dog is bathed as well, but it'll also, it gets on your clothes and it gets on the dog's bedding. When those things are washed, again, it's going down the drain.
I mean, do you think that we're in a position where we can say that using an oral ectoparasiticide then is better than using a liquid ectoparasiticide?
The honest truth is we don't really know. If you've got a dog that swims in rivers and it goes to the groomers a lot, I think it's sensible to use an oral product rather than a spot-on product for sure.
Yeah.
But you've got to remember, if you've got an oral product that's killing fleas, it's got to be getting to the skin, hasn't it?
Yes.
And so maybe some of that's coming off into the environment. And because nobody's measured it, we don't know. But there's also the fact that it's not just a matter of the quantity that's coming off an animal or out in the feces and urine. There's a whole lot of other factors. So how bioavailable is it? So how does it get into invertebrates in the environment? How toxic is it to those non-target environments, not the fleas, but to the invertebrates it meets in the wild? How persistent is it? Does it last a long time? So if you've got an oral drug and much less of it is getting into the environment, say, a 20th of it compared to a spot-on, well, if it's 5 times more toxic, lasts 5 times longer, and is more bioavailable, it might still be doing more harm than the spot-on. And we just don't have that information.
I suppose where that's leading is we should have that information. So are we finding that we perhaps allow products on the small animal side to go through because they're not meat-producing or milk-producing animals, that perhaps VMD has a lower level of requirements than perhaps for the farm situation?
Well, the VMD does have a lower level of requirement, but that's actually enshrined in law. So the VMD are just following the veterinary medicines regulations.
Yeah.
And the law says very clearly, if you're treating food-producing animals with something that could get into the environment and is potentially a risk, you have to do some sort of environmental impact assessment and look at the fate of the products, where they end up and where their metabolites go. But it specifically says for companion animals, you do not need to do that.
Right.
These regulations were written a long time ago. And at that time, we didn't have this culture of treating almost all animals many times a year. And actually, some of the parasiticides back then are not as toxic as some of the parasiticides now. So at the time, it sort of made a certain amount of sense. Now it makes no sense at all because we're using many, many tons, literally agricultural quantities of pesticides on our cats and dogs every year.
If we can go back a little bit, and where I can perhaps at least get a little brownie point from you. Inherently, I understood that when I castrated a cat or spayed a cat, my job was, one, to do the job well and to do it as cleanly as possible. So I was never a big fan of the little white milky injection at the end just to cover myself. And I just did not believe in that. I don't know whether you did or you didn't when you first qualified, but obviously you'd go into a practice where it was standard, and I would kind of break those standards, because if we were operating in a dirty area, then let's get the area cleaned rather than give antibiotics, was my methodology or my thought pattern on that. So we have antibiotics that can be used or have been in the past used prophylactically, but we understand now that we should only use them when there's a problem. And obviously we could talk more about that. We're really probably just having a similar conversation around ectoparasiticides and endoparasiticides now, aren't we? Because actually all of these drugs are useful, and I wouldn't want to lose any of these drugs from my armamentarium, because there is no doubt, for example, that antibiotics have saved many, many people's lives, many, many dogs and cats and other animals' lives. But we have to use them sensibly, because with the antibiotics, with all the resistance we're seeing, we now know that there's lots of deaths that are happening because our antibiotics aren't as efficacious as they used to be.
Yeah, so we're not, the effects on people and animals of overusing parasiticides are not anywhere near as great as the effects on humans of antimicrobial resistance. But obviously in farm work, there is a lot of resistance, and in some parts of the world, there is a great deal of animal health problems because of that resistance, but not in cats and dogs in the UK for sure. We should be replacing these pet health plans, this year-round, buy the drugs all year, use them all year, with a risk-based approach. And there isn't any reason why that can't be built into a pet health plan. You don't have to have a health plan that says come and pick these things up all year round. We just need to be, if you're going to have health plans, be innovative about it. And there are a few people starting to go down that direction.
We've chatted about this, to separate people I know. Obviously, if you do a fecal egg count and there are no eggs in the feces, then probably there's no eggs being secreted into the environment, which can cause a problem. The sort of negative or the corollary of that is you still see studies coming out which, when people test pieces of land, they still find eggs, don't they? But I'll be honest again. When I have my practice, I used to say quite consistently, I'm worming your dog because if you've got children in the house, I don't want and it's a puppy, for example, I don't want your little child to develop eye problems. This is very rare. Even if they catch toxicora, it's most likely won't happen. But it's no good if it happens to your child because I won't have explained it. But are we now at the point where you think the risk-benefit analysis is such that that kind of balance has changed?
I absolutely am. And that's because studies have been done that show that blind worming the dogs, where you give the parasite treatment without knowing whether they've got worms or not, simply does not reduce the overall shedding of those worms. It's a pointless waste of money, effectively. It might be that if you did it...
You should be worming when you see worm eggs in the feces.
I think actually no, oddly. I mean, certainly if you do see worm eggs in the feces, that's a good reason to worm the dog. And I think all puppies should be wormed because obviously toxicora is bad for puppies. But in terms of toxicora, there is a good reason to think that toxicora worms don't actually last very long in adult dogs. So probably when we're worming dogs blind, well, for a start in the UK, less than 5% of adult dogs have worms. So 95 out of every 100 tablets you're giving at least are doing nothing at all because the dogs don't have a worm. But even when it does, probably those worms are going to stop shedding fairly soon anyway. So when you treat them, you're probably not reducing the total number of eggs coming out of that dog very much.
So if we're talking about wormers, and perhaps we can, because I always feel it's important not to neglect or forget the cats, but whilst we're just talking about dogs, your broad recommendations would be worming puppies because they're obviously much more prone to having toxicora and it can obviously cause problems. But then as adult dogs, really you would only worm if you were actually to see eggs, and then you might still question whether you would worm or not.
For toxicora, that's correct. Yeah. But for roundworms, you've also got to think about lungworm.
Yeah.
And obviously, lungworm can do adult dogs harm, but it's not present in much of the country. So we don't have lungworm in our area, so we don't treat to try and prevent lungworm. But if you're in an area where there's a lot of lungworm and you see dogs get lungworm illness, dogs need treating. But again, it should be risk-based. You shouldn't be treating every single dog for lungworm in your area. You should be treating those dogs you think have at-risk behaviours, the ones that go and eat slugs or eat feces because that's likely to have slugs on it, that sort of thing. So you can target your roundworm treatment to those dogs. And to be honest, I'm not entirely sure why we treat most tapeworms at all. The Taenia tapeworms are non-pathogenic. Dipallidium rarely causes any sort of a problem. And the dogs and cats would only get dipallidium if they've had fleas. So why would you treat it if they haven't had fleas? So to my mind, my view of tapeworms is you should only treat them if you actually see them.
Aesthetically, it was never nice seeing those grains of rice coming out of a cat's bum, though, was it? For clients.
It isn't nice, but that doesn't warrant using huge amounts of pesticides. What you should do is explain to owners, if you see these little tapeworm segments, don't worry about it. It's not going to harm your dog. It's not going to harm you. We can treat it and get rid of it very quickly.
Yes.
And that's going to save you using all these pesticides, but also saves you a lot of money from treating every month or every 3 months with whatever product you use.
Because we don't tend to worm ourselves, do we?
Well, no, but we're a lot less prone to picking these things up because we're more hygienic than dogs, for sure.
So what about cats? Because obviously, just before we go into cats, my pet hate, because one of the ways of preventing everything is to pick up the feces, stick it in a plastic bag. But my pet hate is when I start seeing those plastic bags on barbed wire fences or not put in the bin, because the plastic will last for about 500 years.
Yeah.
And as an environmentalist, I'm probably more upset about that than having a bit of feces on my shoe, to be honest.
Yeah, and obviously picking up poo is the most important control factor at all for Toxocara, way more important than worming dogs.
And stick that in a bin.
And make sure it goes in the bin, absolutely.
So what are your thoughts on cats with worming and so on? Because again, we're never going to, realistically, we don't pick up cat poo because they usually go in somebody else's garden or whatever, as cats do. So what are your thoughts there? Because you won't necessarily even know, would you, to see them?
Yeah, there's much less evidence around. In dogs, there's been quite a few studies that show that worming to reduce Toxocara has very little effect. In cats, there's been one small study. It showed the same, but one study is not enough to be sure.
Yeah.
So we don't know to what extent worming does anything. For sure, don't worm indoor cats because where are they going to get the worms from? So I don't know whether it's worth worming outdoor cats. That's the blunt for roundworms. But again, for tapeworms, why would you worm them? Better to explain to the owner that the worms are non-pathogenic. They do people any harm. If you see tapeworm segments, well, then we can worm them and get rid of the tapeworm.
Cats obviously much more prone to getting fleas. My slide on feline dermatology, I had one slide and it was in very big letters. It said fleas. It makes up probably 90% of feline dermatology. If you've got a cat that's got, any sort of dermatological problem, you have to rule out fleas. And if you've got 3 cats in the household, spray the house, obviously with something like a permethrin, S-methoprene product, and then, treat all of the cats. But obviously, if cats don't have a flea allergy problem, we know that on the whole, fleas are more of a summer problem than a winter problem, except for if you're not treating, and of course they get into the house. Once the radiators go on, I quite commonly saw people coming in at Christmas time, having been bitten, their house was full of fleas because, of course, the build-up had happened and they were doing nothing about it. So I think we do need to have some sort of intermittent treatment of cats, but obviously best to do it when you see a flea. But again, with my dermatology hat on, flea allergic cats are very, very good at licking fleas off them, and hence Dipylidium carnanum turns up. So we need to, I think as a dermatologist, I wouldn't want this podcast to sound like we're saying you shouldn't treat cats or dogs for fleas. Would you agree with that?
Yeah, it's the risk-based approach, isn't it?
Yeah.
So there are a whole bunch of risk factors which make certain animals get more fleas than others. And there's also the fact that some animals having an infection has much worse consequences. So you've got 2 reasons there to consider when you decide whether to treat a cat or a dog, for that matter. Yeah. So if you've got a dog or a cat that does have flea allergic dermatitis, well, it probably is a good idea, or atopy, so that the fleas can trigger the itching, then that's more of a reason to treat that animal, especially through the summer. It might not need treating through the winter to prevent the animal getting fleas. If you've got, say, the owner's blind, well, they're not going to notice an early infestation. So maybe that's a good reason to be treating the animal. But to my mind, the real key to all of this is to train owners to check their animals regularly. Give them a flea comb. Most animals, not all of them, but most of them will let you comb the animal. If you do that every day or every other day in the summer, especially say treat the areas where the fleas most likely are, down the back end, all the rest of it. If you see a flea, well, treat the animal. If you don't see a flea, well, you don't need to.
I used to equip all my vet nurses with a flea comb because I said it was a very, very profitable tool to have in the practice because, of course, people would never admit that their animals had fleas. Well, it's always very satisfying to be able to show a few crawling about or a bit of flea feces on a white piece of paper. And then, of course, the nurse with the vet's help could dispense a suitable flea product to get rid of them.
Yeah, absolutely. And there are obviously other at-risk factors. So one of the things that people worry about is the risks of people getting toxocara or worms or Bartonella from fleas. Yeah. And the vast majority of people who get those and have a problem with them, we often get exposed to them. Lots of us have got antibodies to toxocara but never had a problem. People who have problems are immune suppressed and often children. So again, if you've got children, you might want to treat your young cat, which is more prone to get Bartonella, with a flea prevention. And if you've got immune compromised children, that's the sort of key.
Or older people who are immunocompromised, presumably. Yeah. Where we are at the moment, what things are you chatting to people about to say how things would you like to see changing both, at a government level and, at a veterinary practice level?
Well, we certainly want the VMD, the regulations, to require an environmental impact assessment on products that are used, in very high amounts, which includes most of the parasiticides. There is some benefit, I think, to taking fipronil and imidacloprid and some of these other parasiticides off the general sales list and bringing them back into veterinary practice. But frankly, the vets are being irresponsible about use as well, aren't they, with these pet health plans and selling them all year round. So there's only any point in taking them off the general sales list if the vets are going to shape up and start using these products in a risk-based fashion and just not sell them year round. Yeah. So the most important thing is to stop this. Not to stop pet health plans, nothing wrong with using them for vaccines and some of the other benefits they have, but to stop this year-round parasiticide thing. And as I say, it will make your life a little bit more complicated. You have to design your pet health plans. Maybe you could have some that only provide the flea treatment throughout the summer, or ones that don't provide wormers. Or you can go the whole hog and do what my practice has and don't have pet health plans.
Or, if the vet or the nurse is doing flea combings each time the animal comes in, if you're giving the people the ability to come in for 3 or 4 times a year for a consult, which is free of charge, we can do fecal egg cultures, etc., fecal egg counts to check for these things.
Well, you can. To be honest, I think fecal egg counts are not going to be useful at all for this sort of thing. There are places without it. Again, farm and equine, they are.
Yes.
But if giving a blind wormer frequently isn't reducing egg counts for egg shedding for toxocara, and over 95% of dogs don't have toxocara eggs, if you do frequent worm egg counts, it's almost always going to be negative. So people are going to stop coming and doing it for that reason. And worming on the basis of seeing eggs, if you're doing that monthly or something, well, that's actually less effective than just worming them monthly without knowing whether or not they've got eggs. It always will be. So I think the fecal egg count is just going to go nowhere. It's not going to be of any use whatsoever, I'm afraid.
I think, going back to what Mike Willard said, we often have ways of doing things which 10 years down the line we find was not the right way. And sometimes there's also fashions where we do things in a certain way, it goes out of fashion, it comes back into fashion again. The more we can be evidence-based, obviously, the better. So this isn't really a criticism. And we are seeing some of the pharmaceutical firms reacting to this with some of these risk assessment tools as well, aren't they?
Right. Yes, we are. If you go through the risk assessment tools, it will say, oh, well, lungworm, yeah, maybe your dog's not much at risk for this, and tapeworm's not much at risk for this. But they effectively all come down to saying any dog or cat that goes outside is at risk of fleas, and any dog or cat that goes outside is at risk for toxicara. And as the drug companies see it, they say, well, those two things are the zoonotic things. So, yeah, pretty much every dog or cat that goes outside needs an ectoparasiticide and endoparasiticide year round. So, to my mind, those risk assessment tools, they are there for the drug companies to protect their ectoparasite and endoparasite sales.
I think there is also a side of, we are more litigious. And so, I also understand why some of that happens as well. So it is difficult if we've not advised on it. But I suppose similarly with eardrops, as a dermatologist, I wanted an eardrop that just did steroid and would reduce inflammation. I wanted an eardrop that might just treat the fungus, because if I was putting eardrops down the dog's ear and there were no bacteria there, why was I putting antibiotics in? And there's definitely been a benefit, if you like, and we've all, or many of us have wanted it, this one drug that does everything, because nobody wants to try and get 3 pipettes onto a cat. But actually that sort of ease of use perhaps has now, we're coming around the other way of saying if we had products that were much more laser focused on tapeworm or roundworm or fleas or scabies, that maybe would be potentially where we want to go.
That's definitely where we should be.
Much more laser focused on our treatment.
And again, a lot of these pet health plans, they tend to use these broad spectrum products that treat multiple things, but when that is just not necessary. Yeah.
Martin, it's always interesting to listen to you. I enjoyed your BSAVA talk. I think it was, they all come together. Was it this year or last year you did a talk at BSAVA?
I did 2 this year, one on parasites and one on evidence-based medicine.
Yeah, I think I was at the talk. The years go fast, so you often say, oh, that was about 2 years ago, and somebody says, no, that was 5 years ago, actually. And you go, oh, time moves quickly. But yeah, really appreciate the chat today, as always. Thanks for this work, because I think it is important that we question what we do, and that we bring evidence to the things that we do as well. Even when those things are things that we've done for a long time, because we do learn, we do change our opinions on things. So thank you so much for the chat and the time today.
Well, thanks for having me on. It's an important message. Yeah.
Yes. Hopefully I will see you maybe at London Vet Show or sometime soon anyway.
All right. Bye-bye.
Thanks again, Martin. Thanks everyone for listening. It's a contentious issue. We don't shy away from it at VETchat or Webinar Vet. It's good to talk about these things. Do feel free to carry on the conversation in your practices, in your businesses, in your companies. And let's just continue talking. So take care. Hope you have a great rest of the day, and hopefully see you on a webinar or podcast very soon. Bye-bye.